A stroke is a medical emergency. It happens when blood flow to the brain is interrupted. This interruption stops part of the brain from getting the oxygen and nutrients it needs. Imagine a traffic jam in your brain's blood vessels. Strokes are very serious. Every second counts when someone is having a stroke. Quick medical attention is crucial. Without treatment, brain cells begin to die. This can lead to lasting disabilities. Strokes are more common than you might think. Globally, a stroke occurs every 2 seconds. Sadly, strokes are a leading cause of death and long-term disability. Our brains are amazing. They control everything we do, from thinking and feeling to moving and breathing. To do all this, the brain needs a constant supply of oxygen and nutrients. Blood vessels are like highways that deliver this vital fuel. 2 main pairs of arteries supply the brain, the carotid arteries and the vertebral arteries. These arteries branch out into smaller and smaller vessels, reaching every corner of the brain. Just like a car needs fuel to run, the brain needs a constant flow of blood. Any disruption to this flow can have serious consequences. There are 2 main types of strokes, ischemic strokes and hemorrhagic strokes. Ischemic strokes are the most common type. They occur when a blood clot blocks an artery, cutting off blood flow to a part of the brain. Think of it like a clogged pipe. Hemorrhagic strokes happen when a blood vessel in the brain weakens and bursts. This bleeding inside the brain damages brain cells. It's like a burst pipe flooding a room. Both types of strokes are serious and require immediate medical attention. Knowing the difference between them helps doctors determine the best course of treatment. Section 4. Understanding ischemic strokes. When blood flow is blocked, ischemic strokes are a serious medical condition that occurs when the blood flow to a part of the brain is interrupted or reduced, preventing brain tissue from getting the oxygen and nutrients it needs. This can lead to brain cells dying within minutes. Ischemic strokes are often caused by blood clots. These clots can obstruct the flow of blood through the arteries, which are the blood vessels that carry oxygen-rich blood to the brain. When a clot blocks an artery, the brain cells in the affected area begin to die. These clots can form in different parts of the body, such as the heart or the large arteries in the neck. But when they travel to the brain and block an artery, it causes an ischemic stroke. This type of stroke accounts for about 87% of all stroke cases. One way clots form is from a condition called atrial fibrillation. Atrial fibrillation is an irregular and often rapid heart rate that can increase the risk of strokes, heart failure, and other heart-related complications. This is an irregular heartbeat that can cause blood to pool in the heart. When blood pools, it can lead to the formation of clots. These clots can then travel through the bloodstream to the brain, causing a blockage. When blood pools, it can form clots. Another cause is atherosclerosis. Atherosclerosis is a condition in which the arteries become narrowed and hardened due to a buildup of plaque around the artery wall. This is a buildup of plaque inside the arteries, making them narrower and increasing the risk of clot formation. Plaque is made up of fat, cholesterol, calcium, and other substances found in the blood. Over time, plaque hardens and narrows the arteries, limiting the flow of oxygen-rich blood to your organs and other parts of your body. Regardless of the cause, the result is the same, a blockage that starves brain cells of oxygen, leading to potential damage. Without the necessary oxygen and nutrients, brain cells begin to die, which can result in lasting brain damage, disability, or even death if not treated promptly. Understanding the causes and risk factors of ischemic strokes is crucial for prevention and early intervention. Section 5. Recognizing the signs of stroke symptoms. Strokes can cause a variety of symptoms depending on which part of the brain is affected. However, some common warning signs should never be ignored. One of the most common symptoms is sudden weakness or numbness in the face, arm, or leg, often on one side of the body. This can manifest as a drooping face or an inability to raise one arm. Other signs include sudden confusion, trouble speaking or understanding speech, difficulty seeing in one or both eyes, dizziness, loss of balance, or a severe headache with no known cause. Section 6. Fast action saves brains. Time is critical when it comes to strokes. Every second counts, and the sooner medical intervention begins, the better the outcome can be. Strokes can cause significant damage to the brain, and the longer the brain is deprived of blood flow, the more severe the damage can become. The faster someone receives treatment, the better their chances of recovery. Immediate medical attention can prevent long-term disabilities and even save lives. Quick action can mean the difference between a full recovery and permanent damage. That's why it's crucial to act fast if you suspect a stroke. Recognizing the symptoms early and responding quickly can make a significant difference. It's essential to be aware of the signs and not hesitate to seek help. FAST is an easy way to remember the signs of a stroke and what to do. The acronym stands for face, arms, speech, and time. Each letter represents a critical step in identifying and responding to a stroke. Face. Ask the person to smile. This simple test can reveal if one side of their face is drooping, which is a common sign of a stroke. Does one side of their face droop? If you notice any asymmetry, it could be an indication of a stroke. Arms? Ask the person to raise both arms. This test helps determine if there is weakness or numbness in one arm. Does one arm drift downward? If one arm is weaker or drifts down, it could be a sign of a stroke. Speech? Ask the person to repeat a simple phrase. This can help identify if their speech is affected. Is their speech slurred or strange? Difficulty speaking or understanding speech is a common symptom of a stroke. Time. If you observe any of these signs, call emergency services immediately. Time is of the essence, and getting professional help quickly can save a life. Knowing the FAST acronym can be life-saving. It empowers people to act swiftly and confidently in a critical situation. It helps people recognize the signs of a stroke and act quickly. Educating yourself and others about FAST can make a significant difference in emergency situations, potentially saving lives and reducing the impact of strokes. Section 7. Seeking help stroke treatments. When it comes to treating strokes, time is of the essence. The faster medical intervention is provided, the better the chances of minimizing brain damage and improving recovery outcomes. Once someone experiencing a stroke arrives at the hospital, doctors will work quickly to diagnose the type of stroke and administer appropriate treatment. This initial assessment often involves a series of imaging tests, such as a CT scan or MRI, to determine whether the stroke is ischemic or hemorrhagic. For ischemic strokes, which are caused by a blood clot blocking an artery in the brain, a clot-busting medication called TPA, or tissue plasminogen activator, can be given intravenously. This medication is designed to dissolve the clot and restore blood flow to the affected area of the brain. This medication helps dissolve the clot and restore blood flow to the brain. The effectiveness of TPA is highly time-sensitive, and it is most beneficial when administered as soon as possible after the onset of stroke symptoms. However, it must be administered within a few hours of symptom onset. The window for TPA treatment is typically within 4.5 hours, but the sooner it is given, the better the chances of a favorable outcome. In some cases, a minimally invasive procedure called endovascular thrombectomy may be performed. This procedure is particularly useful for patients with large artery blockages who may not be eligible for TPA or for whom TPA alone is insufficient. This involves threading a catheter through an artery to the site of the clot, where a device is used to remove the blockage. The procedure is performed by a specialized team of interventional radiologists or neurosurgeons and can significantly improve outcomes for patients with severe strokes. Early treatment is essential for improving outcomes after a stroke. Rapid intervention not only helps to limit the extent of brain damage, but also increases the likelihood of a successful recovery. Rehabilitation and ongoing care play vital roles in recovery. After the initial treatment phase, patients often require physical therapy, occupational therapy, and speech therapy to regain lost functions and improve their quality of life. Continuous support from healthcare professionals and family members is crucial in helping stroke survivors navigate the challenges of recovery and achieve the best possible outcomes.